December 2016.
Okay, this is an educational video to show the processes involved in doing surgery on a dwarf hamster at Toa Payoh Vets. Now, doing surgery is one thing, but there is planning to be done. You cannot just think that you just do surgery and you forget about the planning, because planning makes your surgery efficient and prompt, so that in the middle of surgery you don't go and look for instruments or look for something missing, and that wastes a lot of time. Now, gas anesthesia in the hamster is very short and very risky. So if you waste time looking for something you forgot, instruments or what, even the forceps, then you find that the hamster wakes up and then you have to anesthetize the hamster again. So the more you do it, the more likely the hamster will die. So that's why many vets think that the hamster anesthesia is very dangerous, and it is dangerous. So now this video I will show you what I do for this hamster with the 2 warts on the chin, from anesthesia, from planning, anesthesia, and to the surgical excision, electrosurgical excision. So now we'll talk about planning first. So planning, you can see from here. The equipment required. Okay, weighing the hamster after knowing the history, that the hamster is okay. Then the equipment is actually very basic. So you can see from here that this is a basic equipment. I mean, you need this forceps to hold the warts or the tumor if necessary, and then this is the scissors to cut it, or you can use scalpel blade if it's necessary. That's why I'm saying that many things that we have to get ready, so that we don't start looking for it, especially when you in the middle of surgery. So scalpel blade, and in this case we don't need sutures, but then in some cases you may need sutures. So actually you should have already scalpel blade sutures. Then this one is more for coagulation. This is potassium permanganate in case of non-stop bleeding. Okay, then this is alcohol swab for you to clean up the area before operation. So basically you have these things, and then there's one more thing, which is the clipper. Actually, now the clipper should be here. See, I should put the clipper on to show. So all these are all ready. I mean, whether you need to clip or you don't need to clip, that is a separate matter, but all prepared. Like going to war. When you go to war, you don't think that you forgot something, and then you find that you are not able to win the war. So basically these are the things. So weighing machine, the hamster is here in a container, so that in a high container, so it doesn't fall off. This is the patient. This is the equipment which I just explained. Now the gloves is for the handling the hamster. Sometimes it bites. It's a bit thick here. And this is for surgery. Now under electrical side, the surgical side, this anesthetic chamber or the container. Now that is the oxygen generator. Hamster will be inside this oxygen generator, which is switched on for 5 minutes first. Okay. Then this will be the isoflurane gas plus oxygen. So normally we will put to 5. So that's why it's very dangerous. So you need to have a very good assistant. Put to 5, then the gas will come through here, and it goes through here, and the hamster will be inside. So give the hamster as little space as possible, so that it will be more efficient. I mean, if you take out this whole thing and then you let the hamster in, it's quite a lot of space, and it will take a longer time, which means you waste more isoflurane as well. So like this is probably the size of the dog hamster, just enough. Okay, so this is the anesthetic. Now this is electrosurgery. So get it switched on, put to cut. So that you cut. Then later when you need to coagulate, then put to coagulate. These are the electrodes. These are the wires which we use. Now today I'm using the loop. This is the loop here. This is the loop. You can see from here is the loop. Because the chin tumor, there's a small stop which I can just slice it, use electricity to cut it off. Then there's one on the chest, you might be able to do it. So using the forceps to hold it, then go in, you hold it up, go in, then cut. And then the other one, the wart, maybe the cut. Okay, after cutting, in some cases we need to coagulate. So if you need to coagulate, either you may have to chain to a coagulation electrode here, which is the one, the ball one. Then you fix it on. You fix this onto here, this ball one, and then switch to coagulate. Then you just put onto the wound, and then you will coagulate the bleeding, the blood vessel. So that is the way to use your electrosurgical equipment. That means the vet must know what to do with the equipment of electrosurgery. Now, there is a big tower here. Now, the reason for the big tower is to prevent electrical leak from the electrical surgical equipment to your hand, because if you put your hand down, the electricity will go to your hand instead of going to the hamster. Now the hamster will be placed here. There is a normal saline to conduct the electricity back to the machine. So the hamster will be here, probably contact hairless skin, and of course hamster is a bit difficult to do hairless skin. So you contact here. Then when I step on, the electricity will go in to the hamster body, and then by the electrode side, it will come back, and then it goes back to the main. So
Part 2, December 6, 2016.
Okay, continuing with the video on hamster surgery and anesthesia. So just now we were at this the use of the electrosurgical machine for cutting the tumor, and I was talking about this tower, right? So this tower actually is meant to insulate the surgeons from being getting electric shock, because sometimes you forgot you put your hand onto the metallic table during surgery, and there's an electric shock here, which is no good, because you are supposed to direct electricity through the patient and out to the mains, back to the mains. Okay, so that is the reason there always must be a big cloth. Don't try and do shortcuts. Shortcuts are not professional, but then of course there are vets who are doing it. Now, so basically this is a preparation. So this, I spoke about the anesthesia, the gas anesthesia. Now the hamster is quite old, 2 years, 2 months, so it's better to not to give the injection, although some vets might want to give some injection first to sedate it, and that is usually recommended for procedure for many cases where the professor always says sedate, then you need less gas. But in old hamsters and old dogs, old cats, it's best just to use gas and be more patient, and normally your surgery must be fast as well. Okay, so now I'm going to start doing the surgery. So before that, you should have an assistant who keeps proper records on the anesthesia side. Now, I mean, I have a proper book, but in this case, because it's only a very simple two areas to record: isoflurane gas, blood oxygen. The start, let me just see the time there. The start, the time will be there, and the end of anesthesia. So that in case of anesthetic deaths and disputes or litigation, we do have proper records to substantiate our professionalism. If not, then when there's a court case, then it's very difficult for the vet to say that he has proper records and proper anesthesia procedures when he hasn't even recorded down the anesthetic usage, the time, and in the dog, the percentage and the duration. And so it's best to have this. Now, okay, now I'm going to switch on the isoflurane already, and then we will start with the surgery. I switch on first. So I put the hamster in. Now the hamster, you can see, I will weigh him first. Normally you wear gloves, especially when they bite. So you just wear gloves. and this is for handling the hamster. But this one doesn't bite actually, but just not be too confident. Now you can see the patient. The patient is 2 years 2 months. You can see that he has this wart here, which is a fast-growing one. The teeth is overgrown, so don't forget to do the teeth as well. And then you can see this another wart here. So basically, electrosurgery is very good. Actually, there's another wart here as well. There's a pimple as well, but we will not stress it too much here. There's another wart here. So actually, on close examination, there are 3. Although this will be done 1, 2, 3, including the lips. You see the tongue is already purple already. Okay, so I will do the measurement, the weighing. So it's just from there. So I put a 0. No, never mind. Put the 0 and then I put here to weigh. For record purpose, 78 grams. Okay, 78 grams, not bad. It just came in yesterday only, and so I will take away this, and I'm going to anesthetize the hamster. So my assistant will record down the time. Okay, time is 12:15. We put it 12:15. 78 grams, 12:15. Okay, we start now. Put it in. Now, the best is bring the hamster as close as possible, rather than far away in case you drop the hamster. And this is the best is to scope it up. It's a bit too thick, but still enough. In this case, we may need to take out the paper because this hamster is a bit bigger than the usual one. Now, I will just take out my gloves because it's not really necessary. We know the hamster is not going to bite. Okay, so I just put it here. Put in first. Put in, close. Then I'll connect to the 5%. That is 5% now. And the flow is about 3 liters per minute. 2 liters per minute to flow. So the best is, okay, that's how we do it now. We take away the unnecessary things already. Then, as you can see, the hamster will be roughly about 5 minutes or less. That depends on the guest. Okay, we'll stop videoing and then we continue with the video later. Okay, we'll stop first. And then okay, ready?
Ready. Part 3 to December 6, 2016.
Okay, we put some gas. So this one we can go through. We'll cut this. And there's another one here, the small one. That's in a few seconds only. Okay, enough. That's 5%. And then we'll check. Need to put 1 hour after surgery, electrosurgery, to remove the lip wart and 2 chest warts as well. The hamster is okay. Now you can see that there's some bleeding from the skin, and you can see that the lip has been excised as well. You can see the lip there's a big wound there because the wart had grown so large that there's no choice but to excise about nearly 6 millimeters of the lip as well, the lower lip. There's still some bleeding from one of the skin warts, but it's not serious. Hamster looks very weak as well, and overall he's still active. He's licking his wound. So we have to wait for him to recover. You can see the lip is really, the lower lip is almost cut off due to the development of the big wart. See the other video. The lower teeth have been trimmed, and overall he looks much better. He's grooming himself, or she is grooming herself. Yeah. You can see the lower gums have been exposed as well. Yeah. But the wart, offending wart, which is quite bloody, has been excised using electricity, electrosurgery we call it. So should be no more bleeding. It's 2 years, 2 months for this hamster. The age, December 6, 2016, Tuesday. Toa Payoh Vets, Singapore. There you can see the big hole there in the lower lip, exposing the lower teeth. There's some bleeding there on this tumor, wart excised. Now the bleeding is stopped already, but so you wait and see, put it down again, because it's better not to put potassium permanganate because it will leak off. Yeah, okay. You just leave it first. How about the chin? Come, show me the chin. Just show direct into the camera. There, show the chin being. You got it. Come this side, just try positioning yourself. Okay, just put it. You don't move because it's hard to focus. No, I need your hand to be either on the floor or on. It cannot be midway. The camera cannot focus. Okay, I can see now. Okay, good. Let's see. There's a hole there because the tumor is quite big. It's probably to move here, but there's no bleeding here. So the bleeding is more from the chest. Okay, can. So you just let it stop already actually. So you're going home afterwards.